Okay, cool. So like I said, my name is Saba. I've been working at the JR for my placement for around 10 to 11 months now, and I'm a part of the Major Trauma Center and a part of the psychological medicine team. So a key part of my role in major trauma is screening for PTSD or post-traumatic stress disorder in patients. And today, what we're going to talk about, and the focus of this talk is on PTSD, what it actually is, the effects the pandemic has had on maybe rates of PTSD, some common perceptions and reactions people might have to what they read maybe in the media, and finally some tips of how to sort of manage common stress reactions and where to access further support. So I'm planning to end just before 5 to get any questions or reflections. But if anyone wants to interrupt me or ask a question, just put your hand up or put in the chat box or whatever, and I'm happy for that. Can we have the next slide, please, Anna? First and foremost, it's good to have an understanding of what PTSD actually is. And some of you might already know this, but essentially, PTSD is when a person has experienced or witnessed an event that involves a serious threat of death, a serious injury, a threat to a person's physical well-being and their sense of self. And this might trigger then symptoms of PTSD, where the response is usually you feel a very intense fear and feelings of helplessness, and you might experience what's known as nightmares and flashbacks. Flashbacks are where you feel that you're in that traumatic situation all over again, even though it might have happened months ago or you're in a completely different place, but it feels like it's happening again. Other symptoms included are rumination, so that's when we're overthinking about the event over and over again in our minds, and it's really hard to stop it. Some behaviors that people might exhibit are avoidance, in which you kind of like avoid activities or certain situations or people, even though the traumatic event is over, because you still feel that sense of danger. And then there's also hypervigilance, in which you feel that you need to scan and survey your environment a lot more than you usually would because there's a fear of that danger or threat happening again. Now, we actually can't fully predict who's going to get PTSD because it's triggered by a subjective experience of the traumatic event. And what this basically means is it is very individualistic, and it depends on the person and their experience of that event and how much level of fear, danger, and helplessness that they experience, and that would then make sense if someone gets PTSD or not. So in essence, PTSD is not a given. Most people don't get it. In the general population, the prevalence of PTSD is 7%. But I guess what the talk today is sort of focusing on is that we've undergone the pandemic, and we've undergone severe changes to what we were used to working as. Our roles during the pandemic have changed. We've been exposed to things that we may not have been exposed to before, maybe more traumatic events than previously seen. So it's possible that some of us might feel that we have symptoms of this, or some of us might have developed PTSD. However, again, I really want to reiterate, this doesn't necessarily mean that you will develop PTSD. It's very subjective, like I said. So in order to also meet the criteria for PTSD, you have to be having these symptoms for a prolonged period of time. And it has to be affecting your ability to function in different aspects of life, like work, home, whatever. So it really depends on the person. So next slide, please, Anna. So what does this mean for us? So sorry, this slide is a bit intense and a bit heavy, but these are just some headlines that I've been seeing in the media and current research. And when I see things like this, I get pretty freaked out. And it's because they're quite scary. And I guess there clearly and rightfully so has been an emphasis on the emotional toll that the pandemic has been having on NHS staff. And at a glance, what these articles are basically saying are that our risk of PTSD has increased substantially. And obviously, this can cause us to feel things like, oh God, do I have PTSD? Will I get PTSD? Do I already have PTSD? And this is a really concerning feeling to have when you're reading this in the media. Next slide, please, Anna. But we have to remember that what the media are basing this research off of, and we have to think about it with a critical sort of point of view or critical hat. The research that the media and other articles are reporting on, they're not looking at all the people who are NHS staff or health workers. They're looking at those specific people who came and entered the studies and reported symptoms. So those in distress are known to report more symptoms and look for things like that to report symptoms for. So we're not really seeing a full picture of everyone, but we are picking up on those who are particularly struggling. Also, with research, they're relying on diagnosing people with questionnaires or screening tools. But to get a diagnosis of PTSD, you need a full assessment, and we can't just simply rely on questionnaires because they overestimate the incidence of PTSD. Another point is the questionnaires, they're not really sensitive to COVID and a pandemic. So, for example, I was reading one of the research studies, and the question was, has the event caused difficulties in you seeing your friends and family? And almost all of us are going to tick yes for that because of lockdown. And this doesn't mean it's PTSD related. It's because the context is different and it's to do with lockdown and COVID, but then that would count as a symptom. And finally, studies are also cross-sectional, which means that they give us insight into PTSD or certain symptoms people will be experiencing there and then at that time point. But mental health is very changeable, it's transient, it changes all the time. So what we really need to see good research showing is longitudinal studies showing who had these sort of symptoms and who actually developed PTSD. But we don't have that at the moment. So I guess what I'm saying essentially is to take the research with a bit of a pinch of salt and think about it from a more critical standpoint. Next slide, please, Anna. But there are sort of common things that we might experience as NHS staff that we could feel like, oh, this PTSD. And these are common experiences that are reported. For example, you might be feeling during this whole pandemic a heightened feeling of fear, anxiety, uncertainty. This might be about safety, it might be about work performance, or a general sense that something really bad is going to happen. You might have noticed changes in your mood, low, flat, numb, irritable, or you might be really jumpy and on edge and you're finding it hard to stop your thoughts. And of course, physical things like eating, you might be eating too much, you might be eating too little, you might not be exercising, concentration is kind of shot, sleep is kind of difficult. So there's all these different things. And another one is really using more drugs and alcohol than you usually would to kind of cope with stressful situations or painful memories that you might have of the things that you've seen during this pandemic. So next slide, please. So I guess these are reactions to distress, and I need to stress to you that these experiences, they might be strange or new, but they are normal. These are common and normal experiences that we're having to a really abnormal event like the pandemic. It's a reaction that we're trying to process, and it's likely and hopefully that it resolves as the pandemic would ease. And I know sometimes it's really easy to get swept away with those media headlines and wondering if you are suffering from PTSD or other psychological disorders. But hopefully this provides you with some reassurance that initially, if you're having those responses that we spoke about, these are normal. However, if some of us feel that we are suffering for a longer period of time, and this is disturbing our ability to function, work, hang out with family, do household things, this is the time to seek further support. And I'm going to highlight this later on in a different slide. And I can't stress enough, if it has gone on too long and you feel that it is hard to manage, it's really important to seek that support. Another experience you might be having whilst listening to me talking about this is that you might completely be okay. And you could be wondering, I'm absolutely fine, but everyone else is really struggling. Does this mean I don't care about my job or my patients? And you might be met with some guilt or feeling like you're a bit isolated in that sense. It's important in that aspect to remember not everyone reacts to things the same way. And this is literally no reflection on how you would do your job or how engaged you feel with the pandemic or how much you care about your patients or your colleagues. So we have all heard it's okay to not be okay, which is totally true, but it's also okay to be okay during this period of time. Each person has their own unique experiences with the pandemic and their own personal ways of coping with this distressing, stressful situations that have arisen from it. So if we take a sort of metaphor for it, that even though we're all facing the same type of storm, we're all in our own sort of boats that are going to get affected by the storm in different ways. Next slide, please, Anna. So just some tips if things are getting a bit difficult and you're noticing that, okay, I'm not really feeling like myself. First things first is to check in with yourself. I'll be totally honest, this is something that I sometimes totally forget to do. And then I wonder why I'm tired or finding it hard to concentrate or just feel rubbish. And what happens is you kind of go on autopilot mode where you're doing your tasks, but you aren't noticing how it feels within your body and the actual emotions that are going alongside this. So in this instance, it's really important to check in with yourself and be honest about how am I really feeling right now. Another thing super important is support network, and I'm sure you've heard this multiple times, family, friends, your work colleagues. This is your circle of support, and it can be really helpful to have around you because sometimes when we have certain experiences, we might feel like it's only us going through that experience. But talking to people and sharing things, we might end up not feeling as isolated as we thought we could, and that can really help with mood. Another thing is identifying things you can control and investing your energy into that. So, for example, I can't control when this pandemic will end, even though I think about that. But maybe I can control whether I go for a run later, watch some really crappy reality TV, or go take a bath. These are the things I have control over. So it's helpful to think about what you can do right now or what you can do after work to help with your feelings or emotions that are coming up. And whilst I'm on that point, it leads into catch yourself ruminating. So ruminating is when we engage in overthinking about the past and the future, and we find it pretty hard to stop. And this is rumination. We all do it at some point in life, some maybe more than others, and we do it because overthinking and analyzing a situation, sometimes we think that will help us problem solve something. So we sit there stewing on it and thinking about it nonstop over and over, when in fact, all it does is get your mind to just spiral out of control from one catastrophe to another. And before you know it, you're sitting there feeling pretty rubbish. So catching yourself ruminating, saying, okay, no, this is going a bit far. I can't do anything about when this pandemic will end. I can't get back what I had then. What can I do right now? You can challenge yourself, talk to yourself, saying, okay, I'm ruminating right now. What else can I do? Maybe distract yourself with an activity or reassure yourself that you're doing the best that you can because you really are. I've heard a lot of people have switch off rituals. This can be after work or before bed. And this is basically, we all know that exercise is really good at immediately uplifting our mood. Same with energizing music. There's been a lot of research recently and that really helps us shift gear from feeling one mood to another. So I often tell people, and do this myself as well, if I'm feeling particularly sad, I'll purposely very loudly listen to a happy song just to kind of change the tone of things. Also for bedtime, sort of switching off, meditation, calming podcasts. Everyone has their own sort of self-care things that they can do, and there's a variety of apps available for that as well. Finally, this one you've probably heard quite a lot, but showing yourself that compassion, self-compassion. We can't be expected to function like we did before the pandemic was a part of our daily lives. And it's good to remember that and give ourselves that out. remember that being compassionate to our own experiences, compassionate to our colleagues, it's vital for yourself, for your team, and for your patient's well-being as well. Next slide, please, Anna. So these are just some bullet points for further support. If you feel like things aren't getting better and you feel like, okay, I need a little bit more, then we have the things within OUH that are helpful. So contacting team well-being leads, talking with colleagues, occupational health referrals from your manager or yourself, the employee assistance program, which is counselors and psychologists that can do one-off sessions, or they can do multiple sessions for you depending on your need. And then outside OUH, if you feel like you need a bit more and you need more help, then self-referring to talking therapy, I think it's called You Matter, and also keeping your GP up to date to sort of understand what options that you have available in your area is really important too. And next slide. So in summary, most of us won't get PTSD and are experiencing normal reactions to stressful events in the pandemic, but some of us may develop it or have it. And it's really important to check in with ourselves and access this further support if you feel that you sort of related to any of the things that I was saying about PTSD. Reading research articles and news stories with that critical sort of cap, using those tips early on when you feel that things are getting a bit difficult. If you use the earlier on you use the tips and the more proactive it is, the better it'll work. And it doesn't let the problem linger. And then when it lingers, that's when it gets a bit difficult. And when it does, then it's really important to access that further support. And finally, it's really important to remember that you are doing the best that you can. And if we can, I just want to finish off with a metaphor on the next slide. So this is called dropping the anchor metaphor. We use it in therapy a lot. It's an imagery sort of based metaphor. And it's a really powerful tool for everyone to use because our imagination is really strong. So what it essentially is that you're imagining that you're on a ship where there's a storm, and the storm is all the difficult emotions, feelings, thoughts that you're having about the pandemic and other events that's happened in life since the pandemic. We can't get rid of the storm and we can't sail to safety easily because the waters are really rough. So what we do is we drop the anchor. Our anchor is anything in the here and now, in the present moment, that's not a part of the storm. This is our self-care. This is our friends and family support. This is our switching off rituals. The anchor helps you stay present and grounded and helps you stay in touch with who you are and what you're doing. So what we're not trying to do is make those emotions go away. We're not trying to make those bad thoughts go away. Dropping the anchor doesn't make the storm go away, but it holds the ships ready and steady until that storm passes. And all emotional storms will eventually pass. I think that reached my time. I think that's it. Thank you. If anyone has any questions, please feel free. I know you have 5 minutes left, but yeah, let me know. Happy to discuss. Thank you so much. Thanks for joining. I know it was a bit of a whistle-stop tour with PTSD, but yeah.
Saba, I guess I have a question, not necessarily directly to you, but to everybody who's joined the call. I'm a psychologist also working in major trauma, and a number of people have approached me saying that they're concerned not necessarily for themselves but for their colleagues, and wondering about how to approach a conversation with their colleagues about how they're coping in terms of PTSD. And I just wondered if that's anything that anyone recognises that experience themselves as having that issue.
I just wanted to say, so there is, so brilliant presentation. Thank you so much. It was very useful and it's such an important topic. I definitely recognize some of the signs and symptoms on my staff. I wouldn't say that is PTSD, but I will say that there is a lot of anxiety and stress around, and at all levels. I have staff that been unfortunately infected with COVID. So when they are, because you know that COVID numbers are rising again in the hospital, they feel quite anxious looking after those patients because they are afraid of getting reinfected. Some of them, they had some mild symptoms. Some of them, they had quite moderate symptoms. And thanks God, despite none of them needed some ITU intervention or anything worse, there is a lot of anxiety and stress around when looking after patients, because I think we had these false hope, let's say, some of them that they literally told me of that they were invincible now because they were double vaccinated, and a lot of them, they are getting infected now. So there is a lot of fear and anxiety around, and it's totally understandable, and it's quite hard. And on top of that, we still continue, unfortunately, with the staff shorting levels. Yes, they are quite worried. Yeah, I must say. So yes, you have in one hand staff that is worried and stressed and of getting reinfected, and you have on the other hand staff that never got infected and they are worried of becoming infected. So yes.
Oh, thanks for sharing, Daniela, is it? No, that's really absolutely, yeah, I would echo that. And that's the sort of thing that I've maybe seen in teams and heard about. Definitely, that's a really important point that you've raised there. And yeah, I guess leading from May's question, do you know, like, have you, I don't know, had any experience with speaking to those staff members about accessing support? Is that something that people are tending to do, or is it difficult?
Yes, I have some staff that has been attending has been in touch with the talking space, and they found quite useful. I have some. No, I was just thinking. I have some also feedback that some people seek for occupational health support and it's not always there, and that makes him even more anxious because, of course, that is the first thing that they remember about contacting, isn't it? It's the occupational health. So yeah.
Okay. Well, thanks for sharing that. It's really useful to know.
Scott is also saying on the chat that he's seen a lot of people in the team and on the wards who are struggling.
Yeah.
And also kind of just speaking on that again, is that, you know, we can signpost for support, and some of the staff are doing that, and they do find that helps, but then because of that anxiety and that uncertainty, their thoughts get pulled back into the same kind of situations, and you can have as many conversations, but it will still kind of come to the forefront. So how can we support staff in that situation, do you think?
So do you, so just so I've understood correctly, do you mean that talking is helpful to an extent, and what to do when the situations are kind of the same? I guess, is that, if I understood that correctly?
Yeah, so we've kind of talked, and we've signposted them, and they've got help, and they've found that useful, and they do see improvements. But because, you know, the wider context of the world, and there's still a lot of uncertainty, they kind of, even though there is positive things happening and things are improving, they get drawn into the kind of cycle of those, you know, like you said, rumination, sorry. And it's how can we help them get past that?
So I guess there's the tips that I've said are really like sort of beginners kind of tips, and it always needs to start with the basic things and looking after those basic things first and foremost for yourself, because it's really, yeah, good to have conversations with other people and divulge what you're saying with other people, and that is helpful. But behaviorally doing stuff about it, like what can we do on a day-to-day basis, because absolutely all of us are kind of thinking, oh God, when's this going to end? And then that rumination does start. But it's about, like I said, sort of catching that rumination, knowing that, okay, thinking this isn't helpful, what can I do in the here and now kind of thing? And that is a skill to develop. It's not going to be easy to do if you're not used to doing it. So it's just about trying out different things in the here and now that you can sort of change and do. There might be small things, but even the smallest things can be really significant in that context.
I'd agree with that, Saba, and I think also in your talk you mentioned about being able to spot what we can and what we can't control, and focusing on those things that we can control. And I think that can be really key when we're in those like you've mentioned about returning back to difficult situations where we feel vulnerable over a long period of time, and whether within that context we can spot what is it that I can do right now that I have some control over. Okay, so when I have that 15-minute break that I'm allocated, for example, how can I take it? Do I perhaps I don't have time to get outside of the building and do what I would naturally want to do. But is there something I can do that means that in that break, I'm not just ruminating over what I've been doing before and what I'm about to go back into, but I'm actually doing something that is about self-care and just trying to capture those small moments in time where you can do something positive and you do have some control at that point, and acknowledging that it's difficult, and bringing some compassion to yourself and your colleagues in relation to that challenge that everybody's facing as a team.
Thank you.
Daniela, did you have your hand up?
Yeah, sorry, I don't know how much you can help with this, but so from my recent well-being check-ins, I definitely one of the most raised point is about like I've said, the COVID numbers going high, and the fact that the trust stopped the asymptomatic staff testing. So there is a lot of anxiety, honestly, that I can tell you. Like, I have so many staff mentioning that to me, that they would like, and of course we are all aware that we can ask for a PCR from the government, but it's different because you could just like work and come out of work, just go there and do your test and coming back. So there is a lot of anxiety around as well, that they feel a little bit unsupported by the trust, that they stop the symptomatic testing in terms of the PCR and the antibodies as well. And even the lateral flow test that now needs to be everything from the government. So I don't know how much you can do about these, but I just wanted to raise that there is a lot of anxiety and stress around about that as well.
I just wonder, Daniela, whether that's something that you can bring to sort of I think you've acknowledged in terms of what we can do about this in this context, but it sounds important and that it's clearly affecting your colleagues, and you've noticed a pattern that it's coming up repeatedly. Whether something like freedom to speak up or COVID questions might be a place that you can raise those concerns with the sort of leadership, to acknowledge that that's an issue that you're seeing on the ground, and see what response you can get from them following that route. I don't know if that's something you've already tried.
No, because I was on annual leave and I just came back now. But yeah, definitely is a very good idea. I think I will have a team meeting, and yeah, I think we will need to do that perhaps. Yeah. Thank you, May.
Does anyone have any sort of final sort of reflections about this? I'm aware we didn't have that much time to reflect, but I will think about that for next time, so we have plenty of time for that.
I just have a small comment to make, Saba, about should anybody be concerned that they themselves are experiencing PTSD or concerned about their colleagues. You've very nicely outlined the different places that people can seek support. I guess I would say with PTSD in particular, there are well-known evidence-based treatments that we offer as psychologists for people with PTSD that have good outcomes, and it is something I know you were stressing before, Saba, to reach out and seek support for. And I would say absolutely, I would endorse that in terms of it is something that we know we have a good established treatment that we can use to support people in that situation. And You Matter would be somewhere that you can initially contact. You can Google You Matter, you can have a phone call with one of the psychologists there, and they can assess and triage and see where they refer you on to for treatment, or your colleague could do that. Or also occupational health, there's now psychologists linked in with occupational health, and where the issue is work related, they will be able to offer evidence-based psychological therapy for PTSD. So please do encourage your colleagues to seek support or do so yourself.
Thank you, May. So I know it's past 5. Shall we stop there? Yes? Okay. I don't know, do these slides go on somewhere or anything? If anyone has any questions about PTSD in particular, I have my email shared. So anyone can drop me an email about that.
Yeah, the slides will be shared on Yammer as well, and as well as the recording.
Okay, great.
And I will just post a short questionnaire if people feel like they could give feedback about the session. Then it's a very short questionnaire. I'll just put it in the chat afterwards.
Oh, thank you. That'd be really good to get some feedback. Okay, thank you, everyone.
Thank you.
Thank you.